We wanted to investigate whether cooling as an adjunct to primary PCI would further reduce the infarct size. So this was a pilot study, 50 patients, anterior STEMI within 6 hours of symptom onset, randomized to standard of care, which is primary PCI, plus experimental group, which was primary PCI, plus endovascular cooling associated with up to 1 liter of whole saline before primary PCI. So we cool down the patient before we push the wire to open the coronary. And this was a pilot study, so there were many exploratory endpoints. We wanted to learn whether this is feasible and safe. The main finding was that, we could, with this new system, we could go down to 33.6 degrees at the time of reperfusion by primary PCI, and this is more than 1.1 degree lower than in previous endovascular cooling studies. So we learned that, we can do it, and we learned that, at least based on this sample, we can do it safely. And I think it's a good background for the pilot study, which will hopefully confirm the signal of reduced infarct size, which we are seeing in this preliminary data. Primary PCI, so to open the infarct-related coronary artery as soon as possible and to reestablish TIMI3 flow, I mean, this is the golden standard. And this reduces infarct size down to 50%. But what we wanted to achieve is to further reduce the infarct size beyond the primary PCI. And therefore, these are cardioprotective strategies, if you want. And one of the most successful, I would say, cardioprotective strategy in at least in experimental settings was hypothermia, but it has to be induced before we open the coronary artery.